And Mayor Peck, we are live. You may begin.
I am going to ask for some help on this. Is this a regular meeting? Is it kicked off like a regular meeting? Yes.
We could do a roll call if you like, Mayor.
Okay. Well, I'd just like to say welcome to the Q&A meeting with Boulder County Health Department. And Dawn, a roll call, please.
Absolutely. Mayor Peck.
Here.
Mayor Pro Tem Rodriguez.
Here.
Councilmember Hidalgo-Ferring.
Here.
I know she's here. There she is. Councilmember Martin.
Here.
Councilmember Waters is absent. And Councilmember Yarbrough.
Here.
Mayor, you've got a quorum.
Thank you. This meeting is for information only, so we won't be taking any votes or making any motions. So I'm going to turn this over to, I guess, Camille. Are you the one that will be presenting? Okay, great. Thank you.
Thank you, Mayor Joan. I just thought I'd have some fun with that, but congratulations and thank you, Mayor and Council and City Manager Dominguez for having us. We do want to extend our apologies for the other evening. We want to be of service to you, and in the future, if you continue to meet in person, we'll of course adjust and be there. I've been to one of your meetings before in my short tenure here, and it was a pleasure. Thank you for this time, because I know it's extra time in your schedules. I have with us today our Deputy Director at Boulder County Public Health, Dr. Lexi Nolan. I also have our Chief Medical Officer, who might have, yes, she is still in the room, Dr. Michelle Haas. She's waving. She's new. If you were used to Dr. Chris Urbina, he retired recently, and so we are blessed, though, to have Dr. Haas. She has a patient to deal with in a while, so if she exits the screen, we will try to do our best without her. And then I also have Trina Ruland. She's one of our amazing county attorneys that might as well be a public health employee, because she knows so much about public health and supports us in so many ways. And so with that said, I have so much gratitude at this time of year to say thank you for having us, and I'm going to turn it over to Dr. Nolan. And I know we have some questions that you might have, and I know she has a few things to bring to your attention. So Lexi, go ahead.
Lexi, real quick, can I jump in just to kind of, so when we worked this out, Lexi actually sent me her presentation. Fortunately, I was able to be part of the admin call. So I did present that information to the council so that they do have that as background, and they received it on Tuesday.
Fantastic. Thank you. And City Manager, you are amazing at doing those presentations, and you're such a great partner. So we appreciate you. I know I'm not a real epidemiologist like our staff that put those together. I'm not a scientist. I am a leader, but not a scientist. And you do a great job at explaining all of that complex information to your council and to the mayor. So thank you for that.
Thanks.
Thank you. Good afternoon, everyone. And again, thank you for accommodating us this time. We apologize. I will take full responsibility for that one. I somehow missed the message that we were no longer meeting virtually. So that's on me. But we are happy to be here today to answer questions. In particular, I do have some slides that are kind of hot off the presses. Oh, but I was just going to say, Susan, if we can hold the slides for just a minute. Dr. Haas has a much more time constraint than we do, and I just want to make sure that if there are any questions that you all have that would be appropriately directed to Dr. Haas as our Chief Medical Officer, that would be great to float those now to make sure that she has an opportunity to respond, and then I can present you with a few kind of hot off the press nuggets that I think that you will find useful, and we can talk a little bit more. Yes, please.
Councilwoman Martin, do you have do you want to say something? You have a statement?
Yes. Well, it's not can you hear me?
A comment.
Yeah. It's a question for Dr. Haas. which is I'm getting some pretty stringent emails from older professionals in my ward and in my network that are saying, why are you being so lenient? Why do we have unvaccinated people working the recreation center? Why do we have this situation where you can swim, at all because you can't wear a mask there? And they're not really happy with the answer that we're following Boulder County and state guidelines, and that we have not taken it upon ourselves to use a stricter protocol. The question I have is, are we just going to be facing this, that as long as we have unvaccinated people, we will continue to have a surge? And is the decision that everybody's going to get this unless they stay really vaccinated? And is what's the philosophy behind the response of staying open?
Can I just interject for a minute, please? Would you mind, Councilwoman? Thank you. Dr. Nolan, how do you want this to go? Do you want to do the presentation first and then the questions after, or what do you prefer, in what order?
Well, my only concern is that Dr. Haas may have limited time with us.
Okay. All right.
So we were thinking maybe any medical specific questions would be particularly helpful to bring out as quickly as possible.
Okay,
That's
so
what I was
Councilwoman
responding to.
Martin was correct. Thank you.
So the question, is there an answer?
You guys, coming off mute.
Dr. Haas,
Yeah. Oh, sorry. It looks like Dr. Haas is having some challenges. Susan, were you going to try to help her address that? I'll get out of the way.
yes. So Dr. Haas, can you hear me well? Or okay, so we're getting some feedback. So when you look at your settings, you're going to see a triangle next to the microphone where it says mute or unmute. Click that and go into your audio settings and make sure that you've chosen the correct speaker system for your, oh, okay.
I noticed that her mute signal is a phone, not a microphone.
Right. So she may have not used the computer as a microphone. You called in. Okay. So in your settings for audio, even though you're using your, oh, okay. So it looks like she's trying to call in now. Let me unlock the meeting for you so that you can do that.
Let me see if I can put you on speaker. See if this works.
This might work.
There you go. Perfect.
We are flexible. All right. So can you guys hear me?
Yes.
Okay. So the question about, so the policy implications, I might also involve like Trina and Lexi, just in terms of our policy approaching, whether or not, so, can we be more firm in terms of vaccine mandates in public spaces? That is a particular challenge. I might, have them take that on. At a high level, what I can say from a health perspective, it is concerning that there are pockets of community members that are not yet vaccinated. a lot of that has to do with access, and some of it has to do with vaccine confidence, both of which we're working on at the, through Boulder County Public Health, to try to improve access to people to get to their first dose, including to 5 to 11, and then also, folks to get who are older who haven't gotten their first and second doses, and then obviously making sure we have access to boosters. And so we are continuing to work on that, and try, we also have a vaccine passport program, if you will, and I'll let Lexi and Trina talk about that as well in terms of how businesses can apply for that program so that they can verify people who are vaccinated, who enter into their businesses and into those public spaces. So those are the things that we're trying to do on a policy level. On an individual health level, the question about, is this here to stay? Is this something that we are going to have to deal with? Unfortunately, I do think, that's my opinion as an infectious disease physician, that yes, I think COVID is something that is going to be with us, that will be something that will likely, hopefully will evolve to something like influenza that will be more seasonal, and that we will emerge from the pandemic portion of dealing with SARS-CoV-2 and COVID-19. But I do think it is likely here to stay. I don't see us eliminating this virus anytime in the near future. And so I think where we can get to a steady state where it's very low transmission, where we sort of end the pandemic part, will require, vaccinating as many people as possible. When we're in a surge, doing things like distancing, wearing masks in indoor spaces where people are far more likely to contract COVID than in outdoor spaces. And then I do think, some of the other treatments that are coming online, so monoclonal antibody treatment not only can reduce the symptoms, it also can reduce the amount of virus in a person's body, so they're less likely to pass it to someone else, and they're less likely to get sick and need to be hospitalized. And then there are 2 new oral medications that also look incredibly promising, that are hopefully going to be reviewed by the FDA. And molnupiravir is one of them, and it'll likely get reviewed in the next couple of weeks. And then the second is the Pfizer drug, which is a combo medication. That one hopefully will also be reviewed by the FDA in the next few weeks as well. And we are starting to have some very early conversations internally about how we, need to get ready to procure those medications and operationalize them. And I think once we have oral medications available to people that can reduce the time that they're sick, reduce the chances that they'll go into the hospital, this will become much more manageable on a personal level, and then also within our community.
I would just add that, vaccine requirements are likely to continue and to even grow and become more palatable as we see employer mandates going into effect and more of the population is vaccinated. In response to your question specifically about recreation centers, it's an interesting question. I suppose we might be able to look at whether the voluntary vaccination program could be applied to recreation centers, particularly in places where masking is difficult, like a swimming pool. But I will say that we're not really seeing outbreaks. That doesn't mean there isn't transmission happening there, but we aren't really seeing outbreaks in that space.
Yeah, my question was really more about whether there is a behavioral remedy or not, right? Obviously, an older person who is more vulnerable to, has more reason to fear a breakthrough infection, feels discriminated against because everybody else is being asked to, allowed to act however they want, and that means that she's still stuck at home, can't use facilities like the gym. And so the question that I was trying to ask was, is there any even effectiveness of closing down certain facilities, or does it just defer the next surge rather than eliminate the next surge?
It's a really good question. I think, kind of what Lexi said, it all depends on where we're seeing transmission, right? And I think, if we're not seeing a lot of transmission and some of those indoor spaces, it may not make sense to close them down. I think what also can be really challenging is, so, a lot of transmission happens in household settings and really close environments. I would say probably the majority of transmission probably happens in a household or informal family gatherings. And Lexi, you can back me up with that Effie data that supports that. What we've seen, another example, this is what we've seen in schools, is that often, not always, but often schools reflect the community transmission. There isn't always, there are certainly outbreaks in schools, but it often is sort of this trickle effect in from the community. It's not necessarily that schools that in and of themselves are driving this transmission in the surrounding community. And so, when we kind of have to look at some of those patterns to really determine what's going to make the most sense. I mean, if we really wanted to eliminate, reduce transmission, we would have people wear masks in their homes, and that's not practical. So it's one of those things where we have to look at where transmission is occurring and then make a pragmatic decision about whether or not to close those spaces down. With swimming, it's difficult because you can't really swim in a mask. And so I think having vaccine verification in place and trying to limit the number of people in that space, renovating the HVAC system in that space, increasing airflow, making sure that when people can swim outside safely, that those are the pools that they're using. Those are probably the best layered mitigation strategies we can offer.
And
Thank you.
Councilmember Martin, if I can add to that. So I remember telling you when they talked about the vaccine passport that we were, as a city, going to submit certain things. And so one of the things we did submit is part of our recreation strategy, and we just got approved, so this is a good chance for me to talk about it, is really giving our recreation staff the ability to create vaccine passport classes. And so we do double check. Everyone has to be vaccinated that goes into the classes. And in that setting, they can take their mask off. But in the rest of our recreation facilities, they have to wear their mask there. So we're kind of dipping our toe in it to a little bit to kind of get at what you're talking about, to create opportunities for those who feel more comfortable in a fully vaccinated setting, to where we can try to create some classes that'll do that. And
swim classes?
Well, swim classes obviously is different because of the masking in the water and those types of things. And I did have a conversation with our recreation staff. When folks are on the deck and they're not swimming, they need to be in their mask, and our staff needs to enforce that. But it's slightly different once they get in the pool. But we can also look at, again, we're dipping our toe in to see if it works. We could look at creating designated times and reapply for the vaccine passport, where we have set times where we will check your vaccination status for you to come in and swim. And that's something we can think about. Again, we're on the front end of this, just trying to see how it works, so we can ensure that we're servicing everyone in our community. But I will definitely push that piece to our staff to figure out how we can schedule it.
I think that would be more equitable for the general population.
And just so you all know, in terms of our staff, it's a good opportunity. We talked about it before. I think this is another good opportunity for us to say this. So we do have the requirement that you will be vaccinated. And if you're not vaccinated, we're going to test you once a week. And I'm getting the compliance reports literally as we speak, in terms of the data coming in and the folks that have been tested. So we have those two components going on. So if they're not vaccinated, we are testing them weekly.
Thank you. Susie has a question.
Councilwoman Hidalgo-Ferring.
Thank you. So I have a couple of questions, and one, is it ever going to get to the point, will it ever get to the point that Boulder County Public Health says we need to shut down? Or, and I kind of heard you maybe answer this in an previous response, where you're looking at individual spaces, and if there's outbreak occurring there, then those individual spaces would be closed down? I mean, are we looking, because early on in the pandemic, when we decided as a council that we would adhere to CDC requirements, the state and Boulder County, what their mandates are. And so now we're kind of, okay, the numbers are going up, and especially among our littles, and we're still open. Where this time last year or, you know, earlier, we were all shut down and the numbers were less than what they are now. So yeah, if we could get a little guidance with that.
Sure. I know Camille will want to weigh in on this one. I will say that a couple of things are really important to take into context. One is that Boulder County's numbers, as anxious as we are, they're a lot better than most of the counties around us. And Boulder County's policies are a bit ahead of the game in terms, we have a universal mask mandate. There's only Larimer and Pitkin County are the only other two counties right now that have a mask mandate. And part of what's going to get us out of this situation is seeing a more statewide approach to some of these mitigation measures, because particularly, as you know, in Longmont, you're right, you're on that border, right? And so anything in Weld, Lotz, and Larimer is affecting Longmont. And that's a challenge. You know, public health is one of those spaces where you cannot do things alone. We have to continue to try to go together. So I think part of our strategy is really continuing, and you may have seen them in the newspapers recently, that Director Rodriguez and other leaders in our region have been asking for a more statewide approach to mitigation that would definitely benefit Boulder County and would probably be more effective than trying to continue to go it alone and get further apart from some of the other counties. But I'll let Camille speak to it a little bit more because she's in the thick of it right now.
Yeah, Dr. Nolan summarized it really well. We're not being quiet as local public health directors throughout the region relative to the lack of consistency from the governor's office, and even the support that the governor can give to the director of CDPHE. And so we've had to take it upon ourselves to do what we feel, and the support that we've been given by our Board of Health to do this, which is implement a layered mitigation strategy to keep us from shutting down. And that was part of the intent when we originally proposed this universal indoor masking order in public places to our Board of Health. We did not want to have to go to a shutdown mode. And we wanted to row in a direction where the governor didn't have to go that way now. And so that was what, back on in early September that we brought that was after the masking order that we proposed and were approved to put in place in our schools in Boulder County. And at this point, council member, I want to say that, you know, many of our neighboring counties are strongly considering going in this direction. They haven't done it yet. I'm hopeful that they will get the support from their electeds, depending on the structure of their county, to do this. But ultimately, we wish in a way that we didn't have to do it ourselves, that we did have that statewide consistency. Then we could spend more of our time urging the public to get vaccinated, holding clinics as we do, but not also focusing on some of the enforcement activities and the messaging that we have to do as to why does Boulder have a masking order and other places don't. There's a lot of energy that's expended in explaining why we did it and others didn't, when if our governor would have simply just followed solid public health advice and added this layered mitigation of wearing masks, we could be spending our time elsewhere. So we're just appreciative that you asked this question, because it gives us the opportunity to share that, you know, and I'm not talking out of school. If the governor were sitting right here, he would likely acknowledge that I say these things, and when I get the opportunity, I say the same to our executive director of CDPHE. It's a respectful situation, but it's factual that we just think more should be done, because I'm not as lucky as some of the other local health department administrators who don't have the support to implement these policies. Although we see a change, and we're hopeful that in the coming days, maybe you'll see some of that change too in the news.
Okay, thank you. Yeah, that is very helpful. And a lot of my frustration lies more with the state, because we are not in silos. The school district where I work at, we have people in some Larimer, we have Weld, we have this cross section. So it's not what happens in Weld stays in Weld, what happens in Boulder County stays here. We really need to have the cooperation of all surrounding areas. And I really wish, and I hope that the governor does take a more firm stance on creating something more universal. The other thing that I had, I guess, so, one of the conversations that we had in council last week was to decide whether or not we should be going back virtually or continue in person. And I really want to make a decision based on, sound evidence as far as, what is the criteria? What are those triggering that would cause us to have to revert back to virtual? Would it make a difference if we continued online, or, if we continued in person, as far as our numbers? I want a little bit of.
I can start it from just a leadership standpoint, and Dr. Nolan and maybe Dr. Haas can jump in on the science part of it.
Mhm.
I would never jump into your ocean and say what you should do. You're definitely following orders. I've been to your meetings, and you're masking, and you're asking your public to mask. I guess I would strongly recommend, though, that if you have immunocompromised public, or public that has hesitancy, or, as Councilmember Martin noted, even our higher risk public who are just by virtue of their age, perhaps more susceptible to infection, that you consider offering a hybrid option if you're not going to go back to remote. I know that's complicated, but civic duty and participation in city council meetings is so important, especially at this time. But considering the numbers that we are in high transmission, it would only just be my humble thought that, if I were to give you any kind of recommendation, that if you could offer something hybrid that would provide some protection of health to those of your community that might be at higher risk. Lexi or Dr. Haas, if you have any other things to add, that would be great.
I agree with Director Rodriguez. I think it creates an opportunity. And when we talk about, one of our goals is safely returning to normal. The normal in this context is the participation piece, not necessarily having to be in person. It's, that's one of our North Star goals. Just one way to look at it.
Okay. No, that was very helpful. Thank you.
I was just going to add, our schools team actually sent out a letter to our school districts and to our public and private schools, to all parents, openly addressed, with some recommendations about the surge and with some information about how the mitigation measures in schools really do work. So we can make sure you get a copy of that as well if you'd like.
So I did get an email because I'm a staff and parent. So I received that email, and I'd be happy to forward it to the rest of council as well. But no, it had a lot of great information on there. It made people a little nervous. I think we're all still in trauma mode where, oh my gosh, they're going to shut everything down again. So I think, us as teachers, we were very concerned about that because we really want to have our kids here. And so if there's things that we could be doing in other realms, so city councils, different kinds of city operations that could just be virtual, so then we could have other spaces like schools in person, that would be my ideal.
It was my intention as I walked into this position only on June 7th to keep children in school for their social, emotional well-being, for teachers too. I came from Illinois, and my child was virtual for months, and it was not the most ideal for her or for her teachers. And so while it's personal for me in a bit of a way, for me and for the community, that was the intention of the school masking order. And I'll tell you this, you know, we met with, and your city manager Dominguez knows this, we met with many of the community leaders and business leaders ahead of implementing the universal indoor masking order after the school one. And while I know there was hesitancy and concern about patrons wanting to still frequent businesses to be in wearing masks, there was a resounding, especially from Longmont and from the Latino Business Chamber, a resounding, but we have to protect the children, the most vulnerable. And if we all don't do this extra layer, we might be compromising their ability to stay in school. So I just want to commend all leaders, including you all, for supporting us in that regard, because I know it's not easy. And I know it's not easy for some of the smaller businesses to implement vaccination policies, for example. But our intention was always, and I heard this phrase, change behavior. Our intent always was to change the behavior of our citizenry to someday be at a point where, and Council Member Martin kind of already forecasted this, where maybe an alert will come on your phone, kind of like an air quality alert, but it will be a COVID alert. Today you want to wear your mask. And maybe we'll get to that point. We wish COVID were not with us, obviously, but it isn't going anywhere. And this ability to change behaviors is why we implemented some of the policies that we did in Boulder County. And I think our ability to put in place very workable solutions is being noticed, and I think you might see some copies of it very soon. And that's just a testament to why we believe in the route that we took in this regard.
Okay, thank you.
Councilman Mayor Pro Tem, why don't you go ahead first?
Thank you very much. And just to remind the mayor, you don't have to call on yourself. You can just speak. Anyway, so I realized that with some of the graphs we've seen, that the capacity for adequate contact tracing, it has been exceeded. I think I've seen that a few times now. But I would like to just ask a quick question. For the ability that is there, where are we seeing the most outbreaks, if you will, or the most numbers that is feasible to track, realizing that, again, we've exceeded capacity for adequate tracing? So
go ahead, Lexi.
So we still identify outbreaks in a lot of contexts. We do focus our resources on cases where there is more likely potential for an outbreak. So we kind of triage our team that way. So it's not that it's not happening, it's just that we really focus the resources in the spaces where we think that there's that potential. Most of the outbreaks that we're seeing are schools. I would say the long-term care facility outbreaks have gone down drastically as they have improved their practices and their mitigation strategies, and gotten their staff much more on board in terms of being vaccinated and having protocols, which is terrific, because that was where a lot of our deaths previously in the pandemic were happening, and it has reversed. Most of our deaths are no longer in long-term care facilities. They are in outside of that context. I think this might be a good time, Susan, for us to share a few of the slides, because I think it'll provide you all with a little bit more context in some of these spaces, and give you some food for thought, if that works.
Would you mind if I asked a question first before we go to those slides?
Sure.
Thank you. As we look at the rising cases on a weekly basis through council, it looks like a lot of the hospitalizations are coming from people who have already been vaccinated. So I'm wondering if you would address the efficacy of the vaccines per the manufacturer, because I'm not sure that the public understands that the efficacy of those drugs is wearing off, not those drugs, those vaccines, and that is the requirement or the need for the booster. Can you address that, please?
Sure. So just to answer very quickly, and some of the slides actually go into this a little bit too, but our proportion of hospitalizations between unvaccinated and vaccinated, it's about 81% unvaccinated and only about 19% vaccinated. And
Okay.
within that 19%, it's almost entirely folks over 70.
Okay,
So
thank
it's
you.
really, yeah, the vaccines are proving effective, mostly durable. We are worried about our older population who, because they got vaccinated first, their vaccinations are the oldest now, and so they will be, decaying at a much more rapid pace. And also because older folks' immune systems sometimes don't hold the immunity as long as younger folks' immune systems. So when we talk about who needs the booster, it is absolutely that older population. We are kind of thinking about 50 plus right now, because if you take into account some of the inequities in underlying health conditions between racial and ethnic groups, then you want to kind of lower that threshold a bit. So we really are trying to encourage anybody over 50 to please, please, please make your booster appointment now. It does provide exceptional protection. Among the deaths, which we are kind of getting in on a daily basis at this point, when we see folks who are younger who die from COVID, they are unvaccinated. When we see folks who are vaccinated who die, they are almost entirely folks in their 80s and 90s. So there's a very, very clear message here, which is everybody needs to get vaccinated, and older folks really need to get their booster right now. Susan, if you can share the slides, then I'm hoping that this is also going to help a little bit with context. And if you'll jump over to slide 35, because the previous ones are the ones that I think that Harold presented the other night. So I wanted to go ahead and incorporate these slides because I do think that there's a few things that are useful in here, and these are very recently developed. So this is a comparison of mask wearing by county. A lot of people have asked if mask wearing public health orders change behaviors, and this is just some very solid local evidence that it does. When Boulder County put its mask order in place on September 3rd, you can see that compliance with mask wearing went up significantly very quickly and has stayed high. You see the same intervention for Larimer County on October 20th, and you see a similar uptake in mask wearing. That's not to say that it's evenly distributed across the county, but it is a significant improvement in the county overall. Next slide. This is a quick and dirty slide because I have not had time to do something pretty with it, but what I just wanted you to see is that alignment of when our mask order went into place and that kind of plateauing of cases. Now, it's true that in the last couple of weeks, we have surged again, but if I were to overlay the case increases in all of those counties shown in the mask wearing slide onto the case rate slide below it, you would see that that plateau did not happen in those other counties. That it's part of why we continue to be significantly lower than a lot of counties in case rates, is partially due to this masking public health order. Next slide. So this is a slide that compares vaccinations to hospitalizations. And I want you to watch something. You can see where Boulder is in the lower right corner, high level of vaccinations, low level of hospitalizations. But I also want you to watch Larimer up there in the yellow. This was on November 1st. So this was less than 2 weeks after they put their public health order into effect. And we know that hospitalizations are a lagging indicator. So it takes a couple of weeks after transmission changes to be able to see the impact. So see where Larimer is now with that high level of hospitalizations, despite a not terrible level of vaccinations. And watch what happened 2 weeks later that gave time for that mask order to take effect. Next slide, please. They dropped way down. The only intervention there was the mask order. So I think that that's a beautiful demonstration of the impact of putting a mask order in effect. That's really helpful. And just to be responsive to your interest in getting state action, Councilmember Hidalgo Faring, this is a great time for city councils and other elected officials to write to the governor and say, not having a statewide approach is affecting our community. Next slide. So this is maps of vaccination rates by census blocks. And on the left, you see all of Boulder County. Right, so you see a lot of the mountain communities have much lower vaccination rates, but they also have much less population density. The map on the right is a kind of an insert of that Longmont area. And this is kind of a micro level view of Longmont in terms of where we see higher levels of vaccination rates. Our vaccine equity team does regularly target neighborhoods with the lower vaccination rates to promote our messages, to work with community groups in those areas to try to support uptake. Next, any questions on this one real quick? Okay, next slide, please. I'm sorry, would you go ahead and go to the next one? I'm going to come back to this one in a second. This one should have been right next to that map, but I just wanted to let you know that we were able to do a breakout of Boulder and Longmont in terms of vaccination rates. We do see a lower vaccination rate in Longmont that may be part of the answer to why we're seeing Longmont has about a 50% increased number of cases compared to Boulder County as a population rate. It's probably a combination of both the level of vaccination among Longmont residents alongside the tendency to probably not mask as much because because Longmont is right next to Weld County and there's that permeability of the county line, people going back and forth. Folks in Weld County frown at you if you wear a mask. So there's a cultural peer pressure component there. So you've got a kind of that mix going on. And we were just trying to get a little bit more clarity on exactly what's going on and why we're seeing those disproportionate number of cases in Longmont. So Susan, if you'll go back to the previous slide, that would be helpful. Mayor Peck, this kind of gets to part of the question that you had. We just wanted to share some of the findings, the recent findings that vaccinated folks are almost 4 times as likely to become a COVID case, that they're 10 times less likely to be hospitalized, and that they're 13.5 times less likely to die from COVID-19. And if you begin to stratify those categories by age, those proportions grow much more dramatic in older age groups. So this is for the whole population, including ages where the impact is fairly even across vaccinated and unvaccinated groups in some of those younger populations, and the numbers become much more dramatic as you look at older populations broken out. Next slide. There you go. So Harold had also asked if we could provide some information on how many of our people hospitalized are from Boulder County. This is a graph specifically of Boulder County residents hospitalized with COVID-19. You can see It's definitely increasing, but the numbers are not super high compared to the number of hospital beds that we have. There are a lot of folks from other counties too who are being supported by our hospital system, but you can see that that the numbers have gone up quite a bit recently.
So Lexi, to kind of help counsel with this, the number that we gave on Tuesday said that we had 98 individuals hospitalized in Boulder County. Are we still in that range?
I think it's continuing to grow, Harold, but I did not pull data today.
Okay. Well, so, and the point was, so we had, let's say 100 that were hospitalized in Boulder County. We had 10 ICU rooms available in Boulder County. And this number is interesting in that at its peak, 30 of those were actually Boulder County residents.
That's right. And I can tell you our ICU beds are down today.
Okay.
Next slide. So these are new hospitalization numbers. It's not the census. It's not how many on a particular day. It's by day, right? So we're actually getting, and this is, again, this is Boulder County residents. So there is, you know, quite a bit of turnover. Some of the discharge challenges that we've had lately with people needing to be hospitalized for longer and longer periods of time is what has been building to put pressure on our hospital system. So there have been a lot of efforts recently to try to facilitate discharges to other venues, other places where people can continue to recover. Next slide. So this is admissions, and I just kind of wanted you to see this compared to other counties in Colorado. This is 7-day admissions. This is by rate, right? So this is per 100,000. So in terms of per 100,000, our numbers are very low. Next slide. But because Boulder County is a big county, the numbers themselves in absolute terms are a lot higher, put us in a much higher category in terms of counties contributing to hospitalizations. Next slide. So I just also wanted you to have a little bit of a sense of the comparison of, this is a great slide comparing Boulder, Larimer, and Weld counties. And Boulder is in the yellow, Larimer is in green, and Weld County is in red. And you can see also that they have marked where Larimer County put its mask mandate in place, and you could do the same for Boulder County. It would be back at the beginning of September, so kind of between that August and September date. And you can see that it dropped quite a bit. It had a little spike, but then it was down again, and it keeps us very much lower. Similarly, with Larimer County, you can see that 2 weeks after the mask mandate went into effect, right? So you have to, hospitalizations, a lagging indicator. The mask order went into effect, people started masking, cases started going down. So then at that point, about 2 weeks later, after people get sick, is when they need to go to the hospital. So then you see that impact about 2 weeks after the order, and you can see that green line and how far it went down. Admittedly, there was a decline in Weld County too, but it was not nearly as dramatic as what we're seeing in Larimer County. Next slide. So before we go to this, actually, would you go back just one slide really quickly? I do want to tell you about a couple of things. The state's predictions now are that previously their prior trajectory on hospitalizations and hospital demand was that it would be starting to level off in the next couple of weeks. That's no longer the case. We are on a very steep upward trajectory right now that's going to be very difficult to interrupt. And so there are a whole lot of other things that the state is trying to do, although not put a mask mandate in place. But there are some other kind of tertiary care interventions that they're trying to do, including increase the number of hospital beds, provide services like monoclonal antibody treatments outside of the hospital setting, bring in additional care providers from other states. So some of those things. I will also mention that, the projection is that we will significantly exceed the number of beds that we have. And so I think that we as a community should be mentally preparing for the likelihood that we're going to see a lot of deaths, more than we have previously. We know that people are increasingly not going to the hospital when they're sick, because they know the hospitals are full, and we're seeing more people dying at home from COVID. I will also say that the cases, some of the modeling that we've seen is that the case rates that we are reporting are likely to be about half of what they actually are across the state, because people are doing less testing at the sites where testing is where the results are automatically sent to the state. They are using more at-home tests, and they are avoiding testing more. And so some of the projections right now, the calculations are that our testing number, our case numbers are about half what they actually are in the community. Next slide. Right, so this is one of the more promising approaches. It's difficult to scale because it's very resource intensive in terms of care providers. Monoclonal antibodies do have to be provided intravenously, but they are very effective and useful for folks who have tested positive, that have mild to moderate symptoms, and who are at high risk of developing severe COVID. There's a whole protocol of what you have to do, including getting a doctor's recommendation for this kind of treatment, that we can forward if that's something that you'd like to also work on promoting in your community, where people can access this service. But I will tell you that we are having real challenges with having enough supply from the state to be able to meet the demand that we have already. Next slide. Hopefully not more than a few weeks down the road is this treatment that uses a pill, which is a much more simple treatment to kind of disperse, right? It's an oral antiviral called paxlavid, and it's under FDA review now for emergency use authorization, and the government's already committed to purchasing an awful lot of it. We are hoping that because the early indications are that this is extraordinarily effective, that we will be able to roll it out pretty quickly in our own community, and it may help us with the upcoming impact that we're expecting to see. Last slide. This last slide is it's a copy of some of those recommendations that Trina was mentioning together. And Trina, you do such a magnificent job of helping to craft some of those letters to our public. And really just some of the summary of some of the recommendations. So you can see, we're asking people to continue to add mitigation strategies, right? So some things public health does through a public health order. Sometimes we need the public to step in and do it themselves. And so we're really trying to encourage and communicate to the public, we need you all to do these things, to ventilate in your home. I will tell you, I know families who do wear masks in their homes because they have an immunocompromised person, and they're not taking any chances right now because that's their breadwinner and they can't afford to lose them. That's a smart move. People really need to think about their risk, the impact of getting this disease on their family, and recognize that despite the fact that it may become endemic and like the flu, it hopefully won't always be this bad. And that's the end of my slides. We're happy to take any other questions you all have.
Councilwoman Martin?
Will these slides be available to us?
Susan, I would like to clean up the slides and send you a version in a PDF form that you would be welcome to circulate if that works for you.
That sure does. Thank you so much.
You bet.
Do you have any more questions? Any more slides?
Well, we could show you slides all day, but I'm not sure that helps after a certain point. I'm sorry we don't have better news. It's going to be tough for a little while. We're doing everything we can at the county. We're so far ahead of other counties in what we're asking the public to do. And we're really working, Camille works so hard to balance what she hears between what the public health need is, what the businesses need. I mean, the businesses are really unhappy about even just masking right now, but it's the best compromise we can find right now between, maintaining what's actually a pretty good record in Boulder County for keeping people safe, including a death rate that's about a third the national death rate, even during the surge, and trying to keep our businesses open and thriving and holding on until we can get to a more stable place so that everybody can really begin to thrive again, because we know it's hard on everybody.
It is difficult, and thank you for this information. Harold, did you have any last comments?
Just some of the questions you asked earlier, and I'll talk a little bit about operationally what we're doing.
Okay.
And so while we do have a lot of folks at work, we are being cognizant in terms of when we have meetings and ensuring that if we don't really need to be in a room together, we're not. And so my team meeting, we switched to being in person because we hadn't seen each other, and now we switched back to online just to avoid that. And we're doing it for a few reasons. One, obviously we understand the risk. Two, limiting our ability to potentially get each other sick, and then impacting our operational issues, because we have seen that on a few occasions. And we're also doing the same thing with boards and commissions, and really working with them and making the determination of, do you need to meet in person or can you be online? And so we're paying particular attention to that now as the numbers are growing. We have, as I said earlier, dipped our toe into the fully vaccinated facilities and how we utilize that, so we can blend a little bit and get back to some of that in-person communication, because that impacts the organizational culture as well. And we will take some of the suggestions of expanding that to other activities that we provide, so people do feel comfortable and they can utilize our facilities. I think that was a great suggestion. Sort of the linkage to, we're trying it on this, can we try it on other things? And as we continue to learn through, we will continue to bring those things to you all as we're seeing if we have the operational capability to do that.
Thank you. This information is very helpful, and I guess council has to decide what we want to do going forward, and it's important that we make the right decision. The perception from my point of view right now is, since we have decided to lessen the number of meetings a month and now going back to virtual, it seems like we have to be careful of how we do it, because we don't want the public think that we are closing them out completely from their public meetings and the information that they want. So this information is great. We all need to think about what we want to do and what's the best way forward. And it's going to be interesting. So and scary. I think you're right. So if there are no more questions, I want to thank Lexi, Camille, and Trina for all this information and for your time. So
well, thank
thank
you
you
so much. We appreciate your partnership so much in this experience.
Yes.
Thank you.
Thank you
Good.
so much.
Working together, we'll make the best decisions,
Yes.
I believe.
Yes, Mayor.
So, thank you very much.
Thank you, Mayor.
Thank you.
Good night, everyone.
We'll end the meeting.
Thank you.